So good afternoon, everybody. I'm Regina Berba. I'm an infectious disease doctor from Manila. So my project will be done in the Philippines. So Project Promise is short for Proactive Moms Inspired to be AMR Stewards Effectively. So I'd like to introduce you to a term called AMR, or antimicrobial resistance. So in my practice in infectious disease, this is probably one of the hardest things to manage. So when WHO listed the major global problems that the world is encountering today, number one is COVID-19. Number two was introduced to us, climate change, this morning. And number three is AMR. AMR is when our antibiotics, our antimicrobials, do not work anymore, and there's nothing to treat patients anymore. So it's estimated to be the next silent pandemic very soon, and it's threatening human life. So for example, in 2019, there's been over 1 million deaths already, related to AMR, and countries within the lower income brackets are significantly more affected by this problem. Okay, so AMR in the Philippines exists. In fact, there are high AMR rates in our hospitals. And you would ask me, well, why don't you approach the doctors or even the veterinarians? And we have already done that. We've been doing that for years. So we recognize that the main drivers are healthcare personnel and animal industry people. But there's still this side of the problem called the silent drivers, and we think that's coming from the community. So, and this is driven by misconceptions, maybe poor access to medications, or even poor education. So we'd like to introduce a concept of reducing infections and reducing misuse of antimicrobials, and we'd like to now recruit mothers to be part of the solution. So WHO actually said that beyond the scope of just the regular hospitals and the animal industry, we really need to spread awareness and include everybody. So in Filipino, we say, #kaalaman ay dagdagan, AMR sa gitna ng pandemya ay labanan. And the problem is not as simple as it seems. So you would see here that the hospital is just one part of it and the family is part of it. But there's like a whole interaction that weaves through the environment, the animals, the food, the industries, and everything else. So for a problem as grave as AMR, we need the One Health approach. And in the Philippines, we've really been trying to do the first 5 circles over the last several years. But we recognize that the teachers, the youth, and civil society needs to also get involved. So last year in 2021, we tested our hypothesis whether we could engage youth because they're the future and we need to get them involved in the problem and in the solutions. So here in 2021, we were able to convince the DepEd to include 37,000 teachers. So we were able to reach them and convince them that this is very important and included in the curriculum. So imagine the impact of 37,000 teachers cascading that information to their students. For every teacher, maybe there's 30 students. So that's a big, big impact, I think. And these are over the years the different groups that are partners and stakeholders in this initiative. And hopefully, next year, we could put FWM in this list. So the Promise Project. This is important because now we know that mothers are pillars of the home. And in addition to having the teachers teach the youth, we'd also want to get the mothers also involved so that the teaching and the things that the students will learn will be reinforced at home. So what we'd like to do is not rocket science. We'd like to reach the mothers of grade school students. We'll be gathering them, inviting them to come for 2 teaching sessions and give them a handbook to take home. So this is the deliverable, and this is not high cost. This is a low cost project. We think each handbook will be somewhere between $2 to $3 each copy. And it will be the Promise Handbook, maybe by FWN, and things all loving moms should teach their kids. It should be culture sensitive, physical, and practical, and easy to digest. So the framework is something like this. We'd like to make sure that children and parents know that we should misuse antimicrobials less, so that in the end, we could have better future for all of us. Factors which will help us complete this promise. So I belong, the rightmost side, I belong to this amazing group of women doctors and medical students. It's called the Mu Sigma Phi sorority, and actually my femtee, Ina Aguirre, is here too, which is right there. She's going to help me go through this project. But Bernie Madrid and Carmencita Padilla, who were as awardees, are also part of their sorority. I think the core team will be very, very good and creative in doing this. We'll be doing the other things too. The mothers, we think there will be enough mothers, and for every mother, there will be many children. So that will create an impact. Funding will promise. I already talked to Unilab, some donors, women's group, and I submitted the proposal to WHO under the Social Innovations for Health Initiative. So join us in the One Health fight versus AMR. I think you will be doing a great service to the future of our world.